Today, I'm going to show you how to do an intramuscular injection, how to inject medicine into your muscle so it gets into your systemic system right away. It's the most common way that men administer testosterone injections. It's what I recommend to almost all my patients. So first thing you do is let's get our supplies together. You're going to need your testosterone, which usually comes in a vial in a box like this, a vial adapter, which will attach to the testosterone vial to make it easier to draw out the medication, a 1 milliliter syringe, and a couple of needles. You'll have a 25 gauge needle to do your intramuscular injection with, and you'll also usually get an 18 gauge needle in case you don't use the vial adapter. You can use an 18 gauge needle instead. It's just personal preference, but I'll show you how to do both today. Obviously, you need a couple alcohol swabs. We want to keep everything sterile and clean. So step one, take out your medication, your testosterone. Come in a box like this. The first time you open it, pull it out, you'll notice it's a big vial and it's got a cap on it. This is a multi-dose vial. And what that means, you're going to get multiple doses out of it. So we're going to reuse it. Good news is it's easy to store. It doesn't need to be in a refrigerator or kept out of sunlight or anything. I just put it in the medicine chest with all my other medicines. But the first time you get it, it's going to have a plastic cap on it that you just need to pop off, just like that. Then every time you use this, you want to make sure you clean it off with an alcohol swab. So I'm going to take my alcohol swab, wipe off the top, and on the top there's a little gray rubber stopper, and that's what we're going to pierce through to get to the medicine. So I cleaned it off with alcohol swab, good to go. And then we attach, one time only, but we attach a vial adapter. It comes in a little package like this. Open that up, pull out the vial adapter. And this is what a vial adapter looks like. And it has a blue cap that you'll attach your syringe to, and a sharp prong on this end that goes into the vial. There's a cover on it right now, so I'll make sure you pull off this plastic cover, and then you can see there's a sharp prong that just pierces through. So you notice there's a sharp prong on the end of the vial adapter, and you just use that sharp prong to pierce through the vial all the way in, and it stays in place like this. Doesn't leak out, it's attached nice and tight. This vial adapter attaches to the vial one time only, stays on there. When it's empty, the whole thing gets thrown away. The nice thing with the vial adapter is it attaches to the vial, and now every time you go to do your injection, all you need to do is take your syringe, screw it on, pull back your dose, and good to go. So let's do that. We're going to take your 1 milliliter syringe, open that up, and you notice your 1 milliliter syringe, it is marked in increments of 0.1, 0.2, 0.3. My dose today, we're going to say is 0.8. So I'm going to pull back to the 0.8 when I do my dose. The syringe is threaded, and so is the vial adapter. So the syringe is just going to screw onto the vial adapter. I want to make sure it's clean. So I'm going to take an alcohol swab, clean off the top of the vial adapter. You'll do that every time you load up your syringe. And then push the syringe on the vial adapter, screw it. Usually takes about a quarter of a screw, and it's tight, it's on. It's not coming off. I can turn it upside down. All good. And then I'm going to pull back on the plunger to 0.8. That's my dose. I'm measuring from the top of the black plunger. So I'm going to pull slowly, and you'll notice when I start pulling back slowly on there, some oil fills up into the syringe. And it's an oil. It's thick. So if I pull back too quickly, what happens is I get a big air bubble. All good. I just push that air bubble back into the vial and start off pulling back a little more slowly. Now I'm looking for the top of the black plunger to get to the 0.8 mark on my syringe. There we go. Check. We're good. Then I unscrew the vial adapter from the syringe. Again, about a quarter of a turn. And I can set this aside, put it in the medicine chest with all my other supplies for the next injection. And now I want to attach my injection needle. The injection needle is usually a blue needle, and it's a 25 gauge needle. It's pretty small. So I open that up, pull out the needle. And again, syringe is threaded. The needle just attaches and screws about a quarter of a turn so it's nice and tight. And then when you go to do your injection, the cap pulls off. It doesn't screw off. It just pulls off like that. Then comes the injection. 2 locations for an injection. The 2 biggest, strongest muscles in the body are your quads and your glutes. So your thigh muscle or your butt cheek. That's where I recommend. Obviously, we've all probably gotten a shot before, say the flu shot, and it's in your arm. But good reason for that. It takes pretty much taking off your pants to get a shot in your butt cheek or your leg. So much easier just to roll up your sleeve when you go to CVS for your flu shot. But a muscle is a muscle. I just recommend the biggest, strongest muscles in the body because best absorption, least amount of pain. So I recommend the thigh or the gluteal muscle for an injection. We'll start with the thigh.